He's overcome multiple cancer diagnoses, a tabloid-ridden divorce, and painful back surgery. Now, just as his life was getting back on track, Tarek El Moussa, star of HGTV's Flip or Flop, is dealing with an old health issue all over again.
The last 5 years of my life has been an absolute roller coaster. A lot of great things. I became a new father. Our TV show became a success, and at the same time, there have been a lot of lows. Going through cancer, I went through a very public divorce. I had a horrific back injury. I was finally to the point where life was great, and all of a sudden, about 2 months ago, I was in the gym and I hurt my back again. The first time I hurt my back was a few years ago. I slipped multiple discs. The doctor said, just give it some time and it might heal. But it was so bad I can barely move. I did some physical therapy, but because I wasn't so much back pain, I was taking a lot of pain medications. My stomach hurt all the time, and I ended up losing 50 to 60 pounds. My skin was bright white. I was really sick. I looked like a cadaver. At the end of the day, after 10 months of zero improvement and living in absolute pain, I decided to get this surgery. It took me a long time to recover from the back injury, and I've been doing amazing. That shaped my life. Things were going great. My relationship with Christina was good. And in the middle of filming season 7 of Flip or Flop, I was doing deadlifts at the gym. Next thing you know, I was on the ground. I hurt my back bad, to the point where I knew I was in big trouble. I couldn't go through what I went through again, so I knew how to do something different. So I looked into stem cell therapy, and I ended up getting 2 procedures. They numb you, they take out fat, inject stem cells back into you. So I'm very, very hopeful it works, because if it doesn't work, I'm gonna be back on those pills and living a horrific life. So my fingers are crossed, and I'm really hopeful this time.
We're now joined by Flip or Flop star Tarek El Moussa. Welcome back, sir.
It's been a while.
It has been a while.
You look good.
Thank you, thank you.
Yeah, you look well.
Out of curiosity, what part of your back were you dealing with these issues?
Oh my gosh, so I slipped multiple discs from the midway point all the way down to where the pain was down in my spine tailbone area, and the sciatica shooting down to my ankle.
So you decided this time around to do the stem cell procedure, right?
They did liposuction. They pulled fat out, which was very weird getting liposuction, by the way.
It's a very California experience.
And I was like, well, while you're doing it, can you do a little bit more? They said no.
Well, you do look thinner, by the way.
I was like, yeah, 2 for 1. This is great.
Yeah.
And so it was wild. So they pull out the fat, you see it, they spin it, and then they injected it through my body, and it searches through my body to find inflammation and damage. And I can say this right now, it's the future. It was a miracle. Within 3 weeks, I had more progress than a year and a half before, and today, standing here, I'm pain-free.
Good for you.
Wow.
Yeah, with that technique, when they take the fat, it's the centrifuge process that somehow separates these cells that are more likely to have a stem cell-like effect.
Joining us now to discuss this is orthopedic spine surgeon Dr. Hooman Melamed, because Tarek clearly had just a wonderful result, and your life, I'll say it, sounds like it sucked in terms of dealing with all the pain. Here he is, pain-free. We wanted to have you on because we're curious from a medical perspective, when it comes to the back, how these treatments work, and then, of course, who might be a candidate.
I think it's very, very important first to figure out the reason why the patient ended up with that condition. What is you have to look at the patient's lifestyle. I think just coming in and sometimes saying, oh, I'm just going to inject some stem cells, we're going to get you going, that may not be the answer, because if the patient's body, for example, if they're full of inflammation, they're not on a good diet, for example, if you're on a processed food, fast food diet, a lot of sodas, you have a lot of inflammation in your body, like a lot of dairy, stem cell honestly is not going to be optimized. So you have to clean up your diet. And also, you have to look at the lifestyle, what you're doing on a daily activity. Is that contributing to having spine problems or musculoskeletal problems? So if you're sitting all day, which we know is not good for you sitting all day, if you're, for example, working out the wrong way, that's not good for you. You're going to do damage.
Can I interject really quickly? In the video, when you said you were doing deadlifts after your back surgery, I cringed because I had spine surgery, 9 months ago, and I can't even imagine doing. I was so scared. Oh, right. Deadlifts. So I love that you brought in that there's no such thing, stem cells or otherwise, that are going to be a panacea for back problems. Right. So you got to change the way you live. I'm assuming you're not going to be doing crazy deadlifts for the rest of your life.
Oh, no. I don't think I can go through this again. Yeah.
We're not 22 anymore.
Yeah,
no,
unfortunately, we're not 22.
No, I can tell you in the last 8 months. I busted my knee, I fractured my hand, I cracked a rib, I tore my shoulder, and I hurt my back.
Welcome to middle age.
Yeah.
I need to stop racing and crashing things.
Well, so I know also you've came on the show before. You've talked about your prior cancer diagnoses, both thyroid and testicular cancer. How are you doing with respect to those?
Oh, I'm in remission on both, which is absolutely amazing.
And to revisit what you were alluding to, Dr. Melamed, you know, as both an orthopedic surgeon and spine surgeon, the importance and the effect of getting to a better weight for people, the impact of carrying too much weight, excess weight, on their bones, on their back, on their joints. I mean, just dropping some weight will have a huge impact.
But let's say you do all that, Drew. So let's say you do all that like Tarek did. So then you get the stem cell treatment. What, in your mind, what's going on there?
Okay, so for example, with the stem cell, there's a lot of like unknowns about it. You know, the people, you had the liposuction, people take it from the iliac crest, you know, people from the bone marrow. Now we have amniotic stem cells, which is like live amniotic stem cells getting from the umbilical cord. You know, I had my own father injected with those recently, and he's starting to see results in his knees. So we're very excited, but we don't know long term. Like, do you repeat it in a week? Do you repeat it in a month? Do you repeat it in 2 months? I mean, nobody really
Still
knows the answer.
experimental in many ways.
In some ways,
right?
But very importantly, it should not do any harm. But also at the same time for spine, like some conditions are not amenable to stem cells. You can't say, oh, I'm going to cure you with stem cell for everything. Well, like what you had, Travis, there's no way stem cell was going to work for that. When you have bad pinching, you have to go undo that. So it's not the answer for everything.
My experience with my knee, I had both stem cells from my fat. They did a little lipo on me. I had stem cells from my iliac crest injected into my knee, and didn't do it, didn't cut it. I ended up having to partially replace that knee because I had gotten to a point where it was too much, bone on bone, not going to work in that scenario.
But but sometimes you have nothing to lose by trying something that's very very minimum. But sometimes I said certain, like spine, if you have like your vertebrae slipping very bad, or you have a bad scoliosis, or you have bad, like getting weakness in your arm, you know, or numbness, or down your leg, you got to like do something. Stem cell is not gonna help that, basically.
Yeah, absolutely. So from my understanding, what it does is it goes in and it searches your body for any damage and inflammation, because like you were saying earlier, one of the biggest causes of injuries in the body and all these different issues is caused by inflammation. So that's why I have cleaned up my diet. I am taking a lot more vitamins. I'm drinking a lot of juice, and then obviously I did the stem cell. So.
A sure sign that you're in midlife is that you're a juicer now. 100%. Speaking of, before we go, feeling better physically, how's life? I know you're back doing flipper flop. How's your relationship, all this stuff?
How's life? Okay, I can walk again and I'm healthy, so that's good. But other than that, yeah, no, we're finishing up filming season 7, and it's a really, really great season, probably my favorite. There might be a little bit of divorced couple conversation.
I was gonna say, how does that play out?
But it also is probably great for your kids to see you guys working together and having an amicable relationship. I mean, I can imagine that's really important.
No, absolutely. Like, we do school functions, we sit with each other, we go to sports games, we all stand together, and it's really important for the kids to know that. But other than that, just still working on the business out here. Filming Flipper Flop and working on possibly shooting a different show, and might be continuing Flipper Flop. So
exciting. Okay.
Exciting.
We'll see.
Well, I think you're a poster child for when your physical health ails you, it's really hard to be happy no matter what else is going on in your world. We're really happy that you're feeling better, and good luck with the show and everything else. Thank you. Dr. Melamed, always a pleasure. Thank you, sir. Thank you. You can catch Flipper Flop on HGTV on Thursdays at 9 p.m. Let's take a quick break.